Hi, everyone. Welcome. I'm Christine Buckley, the host of the Brain Aneurysm Foundation's 1 in 50 podcast, here to raise awareness and provide education on a disease impacting at minimum 1 in 50 people. So thank you for joining us. Hi, everyone, and welcome to the 1 in 50 podcast by the Brain Aneurysm Foundation. We are very fortunate today to have with us Dr. Samaniego from the University of Iowa, who's a vascular neurologist, neurocritical care, and neurointerventional surgeon and researcher. So welcome, doctor. How are you today?
I'm doing well. Thank you, Christine.
Good. Again, thanks for being with us and sharing your time and expertise. So to get going, tell us about your research and your ongoing work with the brain aneurysm, patients, and tell us what led you into this field.
Thank you for the opportunity. So I've been working in aneurysm research for the last 10 years. And since I joined the University of Iowa, we had access to a 7 Tesla MRI, which is a very potent magnet. Basically you can image in very detail aneurysms and arteries of the brain. That's how we started getting some very high quality images of brain aneurysms. And then we developed a pipeline to try to kind of get better pictures of aneurysms. So the idea is try to characterize in better way the aneurysms that patients might have. As you know, it's 1 in 50 that might have an aneurysm. And once we characterize these aneurysms, we kind of try to identify which features makes the aneurysm more dangerous. I can have an aneurysm and we don't know if it should be treated or not. We have some parameters like size or location, but we don't completely understand what can make an aneurysm rupture. So during the last 10 years, we have been studying aneurysms, and thanks to the Brain Aneurysm Foundation and other organizations, we have got funding, and we've been able to continue studying aneurysms.
That's fabulous. And again, we appreciate that. I think, the foundation is really funded by people impacted by this disease, and it's the events that they do, by the most part, that does provide this funding. So it's great to see that you're able to use it and put it to good use. Another thing, speaking of funding, before we get a little bit more into that, I know you're working on highlighting the disparities between ischemic and hemorrhagic stroke. For the folks tuning into this, can you just let them know what the difference is between ischemic and hemorrhagic stroke?
No, definitely. So ischemic stroke basically is like an occlusion of an artery in the brain, and it's more common, it's more prevalent. As opposed to hemorrhagic stroke, which basically is a rupture of an artery. In this case, would be an aneurysm. We have had a revolution on ischemic stroke, with new devices, new clinical trials. The number needed to treat to make a difference in these patients who have large vessel occlusion might be 1 in 3. So it's a huge benefit. Having said that, unfortunately, in terms of hemorrhagic and aneurysm research, because we don't understand the biology very well, we haven't been able to implement a lot of therapies. So there is a huge disparity in terms of funding and also in terms of understanding of the disease process.
Okay, so when we're talking about research funding in that gap, is that gap in fewer grants from federal funding, fewer clinical trials, and less industry involvement, or a little bit of everything?
It affects everything. Basically, we have less NIH government grants, we have less industry funding. We have less organizations like the Brain Aneurysm Foundation who support this type of research, because it might not be as prevalent as ischemic stroke. The problem is that with hemorrhagic stroke and basically aneurysm research or aneurysms, they usually affect middle-aged people, middle-aged patients. So you are in the best years of your life, you're very productive, you might have a rupture aneurysm, and that can create a lot of disability, and patients might be affected for lifetime. So although the number of patients with hemorrhagic or aneurysm strokes is less than ischemic stroke, the impact in some of these patients, is enormous.
Yeah, absolutely. So again, it's sort of somewhat related, but why do you think ischemic stroke has more funding? Is it because it is more common and that there's clearer treatment pathways and that the public awareness is just greater? I mean, there's the Be Fast program, which is certainly very relatable and translatable, versus with brain aneurysms, it's just really hard to make it something succinct. Do you think all these things just kind of play into that?
No, definitely. So it's definitely more prevalent. Usually, ischemic stroke affects older patients, and also there is more awareness. There are organizations like American Heart Association, which are huge, and
Right.
they usually put a lot of emphasis on ischemic stroke and also on heart disease. I mean, they work also with hemorrhagic stroke and brain aneurysms, but because it's less prevalent, there is not so much awareness. Um, so that probably reflects on the amount of funding that we get from government and industry. Again, having said that, it's unfortunate that we haven't experienced a lot of progress in the last 30 years in terms of aneurysm research or understanding how the disease process, probably because of this lack of funding.
So I was going to ask too, like, so what's the real world cost of this imbalance for patients and families? Is it because there's missing prevention tools? Do we need faster diagnosis or better understanding of the biology, which I think you kind of touched upon a little bit?
I think it affects all the aspects of the disease process from the beginning, from diagnosis and screening, then characterization of the disease process, trying to identify which aneurysms might rupture, which ones may not rupture, trying to identify phenotypic characteristics of some aneurysms or some disease processes like polycystic kidney disease, and then also affects treatment and follow-up. We have great tools for treating aneurysms, and we
Right.
have to be thankful to industry because they have developed really nice devices and access catheters. That's definitely has been a revolution in terms of aneurysm treatment. But in terms of understanding the biology or screening patients or trying to find a genetic footprint for possible aneurysms in the general population, we're still in very early stages.
Okay, thank you. And if you suddenly had like a major funding stream for hemorrhagic stroke for the next 5 years, what would be the top two or three things that you would want to focus on with that?
Well, number one will be trying to identify better ways to do a screening of the general population. Nowadays, there is no specific screening criteria for some patients. We usually we recommend screen family members with at least two first-degree relatives who have suffered from rupture aneurysm. But nowadays, that doesn't really translate in our clinical practice. What we're doing is trying to screen at least one first-degree relative. And how do you screen? You have to ask the patients to undergo a MRI or a CTA, which is an imaging modality. Hopefully, in the future, we have some genetic markers. You just get a blood sample. You might identify some genetic markers for the presence of an aneurysm, and then you can go to the next step. Will be imaging, and the second step that we probably need to implement and where funding will be very beneficial is doing another trial where you look at the natural history of unruptured aneurysms, a large trial with a lot of patients, and you follow up these patients for a period of 4, 5, 6, 7 years and see
Mhm.
what's the natural history of these aneurysms. For that, you need a lot of funding. You will need multiple centers. You will need multiple collaborators, and you will need all the tools that we have. We have amazing tools for analyzing these aneurysms, but because of the lack of funding, we have not been able to implement this type of research.
Okay, thank you for that. And just to highlight like something that you said, it is amazing. And, for industry, again, the treatments are there, and the treatments keep getting better and better. And in terms of our education and awareness that we do, I mean, that's something that we tell people all the time. But that's also why like getting the signs, symptoms, and risk factor out to the public to be more aware and try to get a campaign out there like ischemic stroke has with BFAST is critical. And, we talk to so many people who, might lose a loved one, or somebody suddenly ruptured and they're in the hospital and struggling with recovery. And oftentimes, someone had symptoms and went to a doctor and a scan wasn't performed. And then when they find out it's something that can be treated, it's a really hard thing for families to digest that, that their loved one could have been saved if they had been screened, or even if they knew what a brain aneurysm was. There's so many people that we speak with, again, when a loved one is impacted, they'd never heard of a brain aneurysm before. So that's where I just think, just the foundations and medical community really have to come together to be stronger, to get the signs and symptoms out there, and to make the term brain aneurysm to be, as not as relatable as stroke and, heart attack, because again, those signs everybody knows. So that's one thing for us that, we are grateful to industry too for what their tools are to treat them. But you can't treat someone if they don't know that they have it. So that's always one big battle that we have. So if you could paint a picture of success, and if funding did match the urgency, what do you think realistic changes that we could see in 5 to 10 years, like lower rupture rates, better survival, less disability?
Oh, yeah. I mean, in the ideal world, first we'll have better screening tools, so we'll be able to diagnose more patients with unruptured aneurysms. We'll be able to capture all these patients who may have an unruptured aneurysm. That's step one. Step two will be a better triage of patients with unruptured aneurysms. And with this triage, we can decide which patients need to be treated versus which ones we can just watch. We have excellent tools for treatment, but these treatments can be dangerous. We usually quote to patients a 5% risk of complications for treatment. Really good tools, really skilled physicians, but still there's a little risk. So some of these aneurysms may be better not being treated, just watch over time. And then number 3 will be understanding the biology of brain aneurysms. We still don't understand why aneurysms form. We have identified some disease processes that are related with the presence of aneurysms. We have some demographics that we know are more common with patients who have brain aneurysms. But in terms of what's happening at the level of the aneurysm wall or the arterial wall, why we have this bulging, why we have this aneurysms formation, we still don't understand really well what's going on. So those will be the 3 ideal objectives that hopefully with more funding we'll be able to address in the next 5 to 10 years.
Excellent. Thank you. What do you think would be the clearest sign that we're finally kind of winning and getting ahead in this disease?
Hopefully happens in our lifetime. And I hope to see that we have a medical treatment for brain aneurysms, not necessarily go invasively through the arteries of the brain or try to open the skull and take care of the aneurysm, but have a medical treatment that will shrink the aneurysm or will stabilize the aneurysm, some pill or some medication that we can give intravenously, and then we can take care of these aneurysms.
I've heard some different things, obviously, through different meetings and talking to different physicians. What is the impact on someone taking aspirin every day, in regards to potentially preventing a rupture? When you're saying like different ways that could be a win to stop these things, is there any evidence or is there any data showing that is something that could be helpful?
That's a great question. There is some research that points out that maybe some inflammatory process in the aneurysm wall, in the aneurysm, that will trigger the formation of aneurysm and ultimately the rupture of aneurysms. So the idea behind aspirin is that when you take aspirin, that will decrease the inflammation of the aneurysm, that will prevent further growth and possible rupture of the aneurysm. So, nowadays, with this little evidence, when I see patients whom I'm not going to be treating and I'm just going to be watching the aneurysm for the next 5 to 10 years, I usually advise them to take aspirin, a baby aspirin, with the thought that might decrease some of the inflammation. For the most part, if you take aspirin on a daily basis, it's a pretty benign medication. The risk of having side effects or complications from the aspirin are very low. Having said that, we usually advise patients to take aspirin with a full stomach to prevent the formation of any ulcers or any other side effect. Hopefully, that's the other question that we can hopefully confirm with more research. Is really aspirin useful in these patients? We need a large trial, a large study to really characterize and try to identify if aspirin might be beneficial. We think there is a strong signal for that, but we don't have level 1 evidence to justify that.
Yeah. Okay. So what is the potential impact of the reduced federal funding that may be coming for early stage research, to reach these goals that we want to for this disease?
Will definitely will lead to more patients having rupture aneurysms, will lead to more patients having complications from rupture aneurysms, more family members affected from patients having rupture aneurysms, will lead to more delay in the understanding of the biology of brain aneurysms. And the other thing is that, if we think that we understand the biology of brain aneurysm, we might be able to understand all the disease processes, because basically we're looking at the wall of the brain arteries. So might lead us to better understanding what's going on with intracranial atherosclerosis or some other types of strokes. So if there's going to be decreased funding at the industry level or government level, that will affect all of these possible gains that we might get from research.
Okay, thank you. In the last few years, what's given you the most hope in terms of change or, accomplishing something for this disease? Is it AI? Is it new different treatment devices, biomarkers, something in imaging? What do you think is really something that might continue to lead to some sort of breakthrough?
It's really revolutionary what we're seeing in terms of post-processing of some of the images that we are acquiring with MRI. These they don't need to be super fancy MRIs like 7 Tesla, as I mentioned at the beginning. It can be a 3 Tesla MRI, a typical MRI. But we have so much power, so many tools right now to try to process the images and try to see how is the flow in the aneurysm, what's going on in the aneurysm wall, how much inflammation is happening in the aneurysm wall. So that's very promising. I think with the help of more of these techniques, more computational power, and also with the help of artificial intelligence, we will be able to understand better what's going on with brain aneurysms. I'm very hopeful that continues to evolve, and with help of foundations like the Brain Aneurysm Foundation and other funding institutions, we collaborate with other. The nice thing also that I'm very hopeful is that there is a lot of people that are very passionate about aneurysm research. I know different groups in the US and around the world that the main focus is brain aneurysm research. So we have a nice community, we collaborate. So if we exchange ideas and exchange data, we'll make significant progress in the understanding of brain aneurysms.
Yeah, I agree. I think the collaboration is key. And I think, from our research grant program and the scientific session we have, and bringing back prior year recipients and then current year recipients, and really, I think bringing that community together, which really is not that big of a community, to actually share and discuss and collaborate is something that is really important going forward. So for people who are listening, what do you think are the most meaningful ways that they can help the science and foundations like us to move the needle to make things better for this disease? Like joining our advocacy efforts, donating, participating in registries, or all of the above?
You said it. It's all the above. First of all, you have to have awareness. There is this silent killer, which is a brain aneurysm. As you said at the beginning of the interview, anybody can have an aneurysm, and sometimes there are no signs or symptoms of having aneurysm. The next thing you know is that you have a rupture, a brain hemorrhage, and which can kill you. So have awareness of the risk of having brain aneurysms. Being able to, with this awareness, to get involved and participate of some of the activities that are organized by organizations like you, like the Brain Aneurysm Foundation, with trying to raise funds. I know you guys do an excellent work with lobbying with Congress and raising awareness with lawmakers. Try to direct some of the funding into brain aneurysm research. So that another excellent way to get involved, and just trying to get involved with your community. What's going on with brain aneurysms in your local community. If you know of someone who has suffered a brain aneurysm rupture or has a brain aneurysm, try to redirect this person to organization like yours, so they have the support and they find a community that has the same has suffered the same disease process.
Thank you. No, I really appreciate that. And I do want to let everyone know that, we are going back to the Hill on March 18th, and we do have a legislation called Ellie's Law that is seeking an additional $20 million additional per year for brain aneurysm specific research funding. And I do encourage anybody to come and share their voice, and they can go to bafound.org to find that information. But it does take all of us coming together, whether you're a physician, a researcher, a caregiver, someone that survived it, to make better strides. So, we can prevent ruptures in the future and keep families and communities whole. I mean, that's the most important thing for us. But for now, Dr. Samaniego, I just want to thank you for your time, not only today, but I know you are passionate about the disease and what you put into the research and trying to make a difference. Thank you for that, because it is something that we need, and it's going to be somebody like you that does make that breakthrough and does make a big difference. So for the 1 in 50 impacted, that there can be fewer ruptures and people, can get treated, get back to work, and resume the normal course of life. So I want to say thank you to you. Is there anything you want to say in closing?
Well, first of all, I want to thank you and the Brain Aneurysm Foundation for supporting our research and the research of other groups in the U.S. The work that you have done over the last years have been instrumental in supporting research like ours. And I want to thank the patients and the family members of patients who have brain aneurysms or who have suffered the rupture of a brain aneurysm, because I can see on a daily basis how these patients and their families are affected by this disease. So we owe our research and our activity, our clinical work to them.
Yeah, I thank you for mentioning them, because you're absolutely right. This foundation is primarily funded by the people impacted by this disease, and they give back so much to make things better for future generations. So, I echo that sentiment too. Thank you to the patients and the caregivers who are passionate and want to make a difference as well. So again, thank you very much. Have a good rest of your evening, and hopefully I'll see you soon.
Thank you so much, Christine.
Take care. Bye-bye.
Bye.